I've been using Exero Vet for about a full year now. I've used Exero Vet for 2 classes thus far. We've had an intro or a beginner surgery course, as well as a advanced surgery course, which is predominantly where I've used it the most because it's the actual procedures that we're learning and practicing are actually the videos that are on the application. So in the time since I first got the Exero application about a year ago, it had started with maybe a dozen videos or features on it, and at this point it's reached 40 or 50. And in such a short time, not only has the amount of videos available increased, but what you can do with the videos as far as stopping and starting and moving around to different points, as well as the quality, have both improved. And I just can only imagine if they've gone that far in just a year, how much bigger and better it could get. Alright, so in a normal study session when I'm using Exero Vet, oftentimes I'll sort of zone in on the specific topic that I'm trying to learn about. I'll initiate it by putting on the headset, going through the video once and getting a feel for both what it is in the close-up as well as looking down on the actual hands-on procedure. And then when I'm actually studying and trying to really absorb the information, I'll kind of take it out of the headset, place it on the desk and keep it in the zoomed in mode and be able to more succinctly move in and out of the particular segments I'm trying to absorb a little bit better.
Cool.
If I were approached by a student who's considering subscribing to the Exero Vet application, I would say that there's very little reason not to. There's not, to my knowledge, any other sort of resource out there to a veterinary student that can provide this kind of in-depth and visual learning technique just out there at all. And especially for the schools that have it where it's your professor teaching the class you're learning in, there's nothing that compares. And I would say you're doing yourself a disservice by not subscribing to it.